Okay, so here are the 10 most important blood tests for you to take and continue to monitor for the rest of your life. 1. A chemistry panel and complete blood count. This will give you a quick view of your overall health, assessing your vascular, liver, kidney, blood, and cell status. A fibrinogen level test. This is an important factor in blood clotting. Increased levels of fibrinogen signal tissue inflammation and increased risk of heart disease, stroke, and other inflammatory disorders such as rheumatoid arthritis. Hemoglobin. This test measures your blood sugar average for the past 2 to 3 months. It's an independent predictor of heart disease risk and your risk of developing diabetes. DHEA hormone level. We'll talk more about this hormone in a moment when we discuss hormone replacement therapy. Prostate-specific antigen for men. Elevated levels may suggest an enlarged prostate, prostate inflammation, or prostate cancer. 6. Homocysteine. High homocysteine levels increase your risk of heart attack and bone fractures. It can also decrease cognitive abilities. 7. C-reactive protein. C-reactive protein levels can signal systemic inflammation, and it is an indicator of coronary heart disease and other cardiovascular ailments. 8. Thyroid-stimulating hormone. When levels fall below normal, this indicates hypothyroidism. When levels are above normal, this indicates hyperthyroidism. Undiagnosed thyroid problems can progress to a clinical disease state. This is a dangerous scenario that can result in increased risks of atherosclerosis and other ailments. Number 9, testosterone. Testosterone is produced in the testes of men and in the ovaries of women and in the adrenal glands of both men and women. Testosterone levels can decline sharply with age. Both men and women can be negatively affected by a sharp decline in their testosterone levels. We'll talk more about this hormone in a moment when we discuss hormone replacement therapy. Number 10, estradiol. Increased levels of this hormone in women may indicate an increased risk for breast and endometrial cancer. Estradiol hormone promotes healthy bone density in both women and men. Low levels are associated with an increased risk of osteoporosis and bone fractures in women as well as men. Elevated levels of estradiol in men may result in diminished sex drive and difficulty urinating. Other recommended tests include an annual urinalysis to check for diabetes, kidney disease, or infection, a body fat percentage test, a fat-free mass test, a hydration test, a basal metabolic rate test, a body mass index test, and a VO2 max test to read how much oxygen you're extracting from a given volume of air. This measures your lung health, the amount of hemoglobin in your blood, and your heart's pumping ability. And for those 50 and over, a colonoscopy every 5 years.